I appreciate it. Okay, so obviously the Food and Drug is not going to approve anything that's not safe. So, we have this dictum in geriatrics, above all, do no harm. And this is a very vulnerable population. So one of the things that was impressive to me with the study, they looked very carefully, of course, at side effect profile, is that the rates of somnolence and lethargy were relatively low. So this is not a knockout drug. I think it keeps patients maybe a little bit sedated, a little bit more calm, or much more calm, but a little bit sedated, but they're still responsive. They're not out. They're not knocked out. So that was very good. There is a small incidence of hypotension, even lower rate of orthostasis. So that's something that's going to need to be kind of looked for and monitored for. But I think the next steps to your most recent direct question, if I was the company, would be to look at this same compound in delirium. So we do not have anything that's FDA approved for delirium or acute confusion and disorientation in older adults with or without dementia, where we're really needing to get the patient under control because that acute confusion and disorientation is often accompanied by irritability. But we don't want to knock them out because we need to figure out what is the cause or what is triggering this delirium. Delirium often occurs in the hospital, most often in older adults. It can occur anywhere, but most often in the hospital or healthcare setting. A risk factor is advanced age, and another risk factor is pre-existing cognitive impairment. So if we look at the older adult population with pre-existing cognitive impairment, i.e. dementias, with now an acute delirium, I think this would be an ideal compound for that scenario. Another unanswered question about what this drug or this compound can do is how often can you use it? Can it be used for chronic agitation to prevent further agitated behavior down the road? Can it be even given maybe preventatively? We don't know. But again, the way this drug has been studied, and I think where they're focusing it, is appropriate in that it's different than the other anti-agitant drugs, including the most recently approved drug, which was Brexpiprazole, which is the only one that's approved for agitation in Alzheimer's dementia. That's the only acute drug. So if I was an emergency department physician, I'd be very excited about this drug because it gives me a tool, an FDA-approved tool that's not been available previously, assuming it gets approval. Gives me a tool that I can utilize. And the older patient that comes in, I don't have a lot of history. Maybe we know they have Alzheimer's disease, but we're not sure what all the triggers are. But I need to, for their own safety and the safety of others, I need to get them under prompt. I don't have days or weeks. Prompt control within minutes, maybe within an hour to two, generally speaking. And then it gives me an opportunity to work them up, to evaluate them, to see what may be additional contributors to their agitated behavior. So I think that's, to me, very exciting because it's very different.